Hi friends, today let's talk about how age affects our fertility. Fertility is the ability to have a baby or conceive. Well, we need to understand age and fertility are very intimately related, and as age increases, similarly our fertility declines. So it is an inverse relationship and we have to keep this thing always in mind. I am Dr. Gunjan Gupta Govil, Director and Founder Gunjan IVF World. I am a IVF and a fertility expert with specialization in laparoscopic surgeries. So, your first question to me will be how age affects fertility and why does it do so? Well, it is a biological fact. That is, this is how nature has destined thing. That is how our body behaves, that our fertility declines with age. The fertility is highest in mid and early 20s and it gradually starts declining around 30 years of age, so more so that it declines dramatically around 35 years, and 40 years and above it is nearly impossible to mother a baby. So we need to be very careful about our age whenever we are planning a child. Another important thing, or what people have in mind, is that whatever be my age, IVF is the solution to that. Well, IVF is a technology which does help you in conceiving, but even IVF cannot fight age. The chances of IVF are best the younger you are. So if you are having a problem and you think that you might need IVF, do try and plan as early as possible so that you achieve the best success rate. Next question which comes to the mind is how age affects a female's eggs. Well, that is a very important question. We need to understand that the number of eggs a woman has are fixed, and they have been fixed when as early as when the baby girl is born. So everybody is born with a fixed number of eggs. After that, what happens is only attrition. We have few millions, around 4 million eggs at birth, which reduces down to around 4 lakhs when we achieve puberty, that is when we start getting our periods, and then it further declines until we achieve menopause. Only around 400 eggs ovulate, that is, it is only 400 eggs which are utilized for the purpose of achieving a pregnancy, and rest all go into attrition. So the natural fate of the eggs is to actually die a natural death. So you can understand that eggs can be depleted very rapidly. Also, another fact is the younger you are, the better eggs release at an early age, and the poorer quality eggs are left for the later age of life. It is just like if we go to a market early in the morning to buy, for example, mangoes. The shopkeeper has a fixed carton of mangoes. So naturally, early morning or whenever we are young, we'll get the better mangoes. If we go to get something towards the end of the day, we will only have a choice from the leftovers, and we will have to pick and choose from there. The same thing happens to our eggs. So it is very important to understand this thing and plan whenever possible, that plan our baby earlier on in life as far as possible. Also, as we age, what happens? Our chromosomes undergo a change. They develop certain abnormalities with aging, due to which the quality of eggs also goes down. So another question is that does age not affect men? Well, it is not so, but the men have an advantage that firstly they age later. That is, the chances of having a problem is more likely whenever a male is more than 40 years of age. they also can have problems in the sperm number, or quality or motility goes down with age. But they have another advantage: the sperms are produced daily in millions, and what you need is a single sperm. So whenever the natural chances of pregnancy are concerned, even if the fertility does decline as the male age increases, it does more so in cases of females. Now, coming to what are the chances of having a pregnancy at any given age. See, we need to understand, in a single menstrual cycle, that is in a single cycle, if the female's age is 25 years and below, the chances of achieving a pregnancy is 20%. Whereas if the same thing becomes that the female age is more than 35 to 40 years of age, the chances of achieving a pregnancy in a single menstrual cycle is only 5 to 10%. So as you age, the chances of having a pregnancy declines. Then what are the other things which happen? The chances of baby having birth defects also increases. There is increasing chances of chromosomal abnormalities, which we call as aneuploidies, in which the chromosomes sometimes get an extra set of chromosomes which can affect the baby, and the most common in this being Down syndrome. I can give you a comparative data to just give you an idea how age affects the baby as far as the abnormality is concerned. See, if you are a mother at the age of 20, the chances of having a baby with Down syndrome is only 1 in 1500 babies. But if you are a mother at the age of 40, the risk increases to 1 in 100 babies. So actually the risk of having abnormalities increases significantly in the baby. But still, it is most important to remember that despite everything, most of the babies are born normal, so nothing to panic or worry about. Another problem which comes with aging is that the female has increasing chances of gynecological diseases like endometriosis or fibroids in the uterus, which are like non-cancerous tumors, but they decrease your fertility. Also, she can develop medical illnesses like diabetes, high blood pressure. Then there is an increased chances of miscarriages and also premature deliveries. So that is why if we plan a baby early, it is always better. So coming to this, so as we have understood, it is the female age which matters more significantly whenever we are planning a baby, though male age also affects. For example, what does the research say? Suppose we have a lady who is young, less than 25 years, and we have a male partner who is also young, 25. Then the couple will take around 5 months to get pregnant. But on the contrary, if the female is still young, but the male is more than 40 years, then for the couple to get pregnant, it takes almost 2 years. So male age also affects fertility, though not as drastically as the female. So at the end of this video, all I would like to say is have a reproductive life plan. Answer a few questions. Do you want to have a baby or you don't want to have a baby? If you want to have a baby, do plan your pregnancy in time as far as possible. If you think you are aging and you don't want to plan, you have career to follow, or you are not sure who is your partner, you can go with technology. That is, you can take help of IVF technique, in which we can freeze your oocytes or eggs if your partner is not fixed or you're not sure about things. Also, if you are married or you're partnered and you're sure that you want to plan a family with the same person, you can freeze your embryos, in which the eggs are taken from you and the sperms are taken from your partner, and we fertilize them and freeze them, and they can be frozen for years and years together and can be placed inside your womb at a later age for you to help to get pregnant. And what's the biggest advantage? Those embryos will behave as if you are young at that time, even if you may have aged. So that is very important to understand this thing and have a plan in mind. So all the best to you guys. I hope you enjoyed my videos, and if you like it, do subscribe to my channel Gunjan IVF World. Thank you.